Hello, my name is Dr. Jonathan Campion. I'm Director for Public Mental Health and a consultant psychiatrist at the South London Maudsley NHS Foundation Trust, which is the largest mental health trust in the UK. I co-chair the Public Mental Health section of the European Psychiatric Association, and I chair the Public Mental Health Special Interest Group of the World Psychiatric Association. I co-chair this Public Mental Health Working Group of the World Federation of Public Health Associations, and I'm an honorary professor of public mental health at the University of Cape Town in South Africa. So yes, I have a number of roles at local, national, and international level. At a local level, a lot of my work is engaging with public health teams to support, first of all, the estimation of numbers of people affected by mental health conditions in their locality, taking into account various kind of factors such as deprivation. Then the numbers affected by different risk factors, and in particular higher risk groups. And then looking at the coverage of interventions, both to treat mental health conditions, prevent associated impacts, prevent mental health conditions, and to promote mental well-being and resilience. So understanding population need, and with that to then develop a set of recommendations and an action plan to sustainably address that need in line with the UN SDG target of universal health coverage. So at a local level, I'm supporting public health teams to also fulfill statutory duties to understand need and put in place actions to address that. At national level, I'm engaged in conversations with policymakers to support, I guess, policy-related decisions about what are the opportunities to support improved coverage of mental health conditions. And with the Public Mental Health section in the European Psychiatric Association, looking at various opportunities to enhance population knowledge and understanding of mental health, but also similar to the WFPHA, understanding about what are the resources that can support psychiatrists to adopt public mental health work.
Well, I'm Jutta Lindert. I'm Professor of Public Health from Germany with a specific focus on public mental health. And I'm at the moment the co-chair of the section on public mental health of the European Association. I founded this section like 20 years ago because in the field of public health 20 years ago, many people did not speak about mental health. And now the section in the European region is expanding, and I'm very happy that it's expanding globally as well, so that it's reaching out to the World Federation, because mental health is or has always been a little bit at the margin of public health. And now it's becoming more and more a focus and of specific interest.
So the World Federation of Public Health Associations launched this new public mental health working group on May the 2nd last year in 2023 in Rome during the 17th World Congress on Public Health. I co-chair this group with Professor Jutta Lindert, and other members of the group include Professor Bettina Borisch, Dr. Marta Kameniti, and Professor Paul Unschuld.
Well, I was thinking about it, and I think the first time I participated was in 2002 or 2003. But it was observing what the World Federation has been doing, so I didn't have time to actively involve myself and serve in the World Federation. But I'm observing what the World Federation has done in the past years, and I think it's necessary to to look at other parts of the world beyond Europe?
Well, I trained as a GP initially, and I saw a lot of mental health as part of my clinical role. And I worked then in low-income country settings where I noticed that actually mental health was a large driver and a result of various determinants. And it was extremely ignored. I therefore became very interested in how preventing mental health conditions, promoting mental well-being and resilience would be a way to sustainably address the large amount of mental health issues, particularly affecting more deprived communities. And so after my general practice training, I did psychiatry training, then got involved in associated policy development at national level, and since have been interested in how to implement evidence-based public mental health interventions to sustainably improve population mental well-being and reduce the impact and burden of mental health conditions.
Well, of course, a major goal is to improve the health of the population, especially of those population groups living in vulnerable situations. And for me, as a researcher, it's of specific interest to try to identify the risks and mitigate and reduce the risk for those living in vulnerable situations. So for me, public health should combine research and measures to reduce the risks which have been identified. Well, there is a slogan from the WHO that there is no health without mental health, and therefore mental health is really at the something which is very important for everyone, and not only mental health conditions or mental disorders which are affecting every third person around the world during their lifetime, but probably mental health and resilience. So the positive part is of importance. How can mental health be supported, be strengthened? How can population groups be prepared for changes and for transformations? And how can resilience be supported in the population groups? And how can the external risks, like environmental risks and social risk, be reduced to improve population's mental health?
So there are various definitions of public mental health that can sometimes make I guess, descriptions difficult. But I think for me, public mental health involves a population approach to sustainably reduce the disease burden from mental health conditions and to promote the population mental well-being and resilience. And essentially, this is through the implementation of evidence-based public mental health interventions to prevent such conditions, to prevent associated impacts, to treat conditions as soon as possible, and promote mental well-being and resilience. Well, mental health conditions account for a large proportion of disease burden globally. So the estimates vary, but some estimates suggest up to a third of disease burden as measured by YLDs. And this results in a broad range of public health relevant impacts. Mental well-being also has a broad range of impacts. As I mentioned earlier, there are evidence-based interventions exist to prevent mental health conditions, to prevent the associated impacts of such conditions, to treat conditions, and also to promote mental well-being and resilience. Now, different types of interventions are provided by different sectors. So providers include public health, schools, employers, health settings. However, there's only a minority of people with a mental health condition who receive treatment, even in high-income countries. There's far less coverage of evidence-based interventions to prevent the associated impacts of mental health conditions, such as unemployment, absence from employment, associated criminal justice issues, and educational impacts. And there's very, very low implementation of evidence-based interventions to prevent mental health conditions or promote mental well-being and resilience. And this implementation failure results in a population scale level of preventable suffering, broad public health relevant impacts, and associated economic costs. If we can improve the implementation of evidence-based public mental health interventions, there will be broad impacts, including to policy objectives associated with public health. And therefore, public mental health approaches represents a key opportunity for public health.
We are enthusiastic of disseminating and of sharing the knowledge of mental health, bringing together people from different sectors, people with different expertise from different countries. So one of the main goals is to disseminate knowledge, to deepen existing knowledge, and to establish connections, to conduct more in-depth research on one hand, and on the other hand, to disseminate knowledge, maybe in summer schools or in webinars, so that really we can serve for mental health literacy and improving public mental health.
So the aims of the group so far have been to support the sustainable reduction in mental health conditions and to promote the well-being and resilience of populations. And this can be divided into 5 different areas. Now, this is so far in our working group, and obviously these things are developing all the time. But the first thing is to facilitate public mental health knowledge, training, and practice. So that includes highlighting relevant resources that a broad range of sort of practitioners can access. The second aim is to support the integration of public mental health into the work of public health practitioners. And I think that first aim of training and education can support that. The third aim is to improve population awareness about mental health conditions and mental well-being and resilience in order to facilitate improved mental health across populations. The fourth is to support collaboration between practitioners and researchers from different parts of the system. So, as I mentioned earlier, public mental health interventions can include treatment, prevention of associated impacts, prevention and promotion of well-being and resilience, and relevant interventions are provided by different parts of the system. And so this collaboration between different parts of the system to facilitate coordinated approaches is critical. And lastly, the fifth aim is to support the implementation or research around the implementation of all existing evidence-based public mental health interventions, but also, of course, to support research in areas of other key areas to support the implementation of practice. There are 4 actions to achieve the aims. The first is cross-sector and multidisciplinary collaboration. The second, dissemination and development of relevant resources, publications and training. The third, presentations and workshops at World Federation of Public Health Association and other organization conferences. And the fourth is publications highlighting new and evolving relevant developments. And just as an example of collaboration with other sectors, on World Mental Health Day last year in 2023, the World Federation of Public Health Associations, the World Organization of Family Doctors, and the World Psychiatric Association signed a public mental health joint statement recommending a coordinated whole system approach to address the implementation gap and sustainably improve population mental well-being and reduce the burden and impact of mental health conditions.
Where do I see public mental health in the next 5 years? Maybe that no one in the field of public health speaks about public health without acknowledging the importance of public mental health, and maybe to bring out mental health out of the silo, so that it's not something which is stigmatized and people don't dare to talk about mental health. But a dream would be that it becomes normal to speak about mental health, like it's normal to speak about a flu. So to reduce stigma around the world, stigma which is associated with mental health conditions.
Well, I highlighted the level of implementation failure. The level of implementation failure is particularly higher, is even higher in low and middle income countries. So there's a huge opportunity to address this. At the moment, there is lack of coordination between sectors. There's a lack of a public health approach to mental health. In the next 5 years, what I would anticipate and hope, particularly through the work of this working group, is that there will be a more sort of evidence-based and coordinated approach to improve the implementation of evidence-based public mental health interventions, so that in 5 years' time, we will be clear about the size of the implementation gap, how far we've moved, and the remaining actions to support universal health coverage, including for mental health and including for the more upstream interventions to prevent mental health conditions and promote mental well-being and resilience.
Oh, people can do a lot to support others, and basically maybe it's one of the messages that supporting others contributes to supporting one's own mental health. Maybe caring is one of the fundamentals of becoming more mental health aware, so caring and establishing caring societies. Besides the traditional methods which are very well known, such as physical exercise and getting enough sleep, but I think we should really try to identify other methods and other interventions, because there is a huge gap between the needs of the population and the offers for care at the moment. So apparently something is missing, which maybe or hopefully a little bit the section can contribute to reduce this gap. Well, I think it is really necessary to give room and to disseminate the message of mental health in different sectors, and to identify channels, how to disseminate more in-depth knowledge about not only mental health conditions, but about mental health and what can be done to become resilient for different age groups.
So people, the population, we all have a role to play. In the UK, for instance, or in England, it's almost 1 in 4 adults experience at least one mental health condition each year. And it's 1 in 5 under 18s experiencing at least one mental health condition each year. That means that every family is affected, whether directly or as a carer. This means that there is real need for an understanding about the recognition of the recognition of mental health conditions and what to do about it. And we don't necessarily need to start by going to see a health professional. We can do a lot to intervene at an early stage. So, for instance, physical activity has been shown to be effective as a way of treating early depression. We also need to be improving the awareness of an understanding about how we can prevent mental health conditions in ourselves, in our communities, and across regions. And similarly, to understand how we can improve knowledge and the abilities of individuals, families, and communities to promote their mental well-being and resilience. So, of course, that's a literacy. We're promoting literacy, which is an important area. However, in terms of what people can do to support others, there are public health practitioners have a particularly important role to understand what actions are required at different levels to address the implementation failure. So this includes informing policymakers about the size of the unmet need and what the most implementable opportunities are to scale up particular interventions which would have maximum population mental health impact, as well as a broad range of impacts across other sectors.